Dr. Martin Chris has worked on that specific cruise ship 4 times and joins us now. Doctor, we thank you so much for being here on Top Story. Take us inside that ship. When a patient gets sick, how closely is the doctor on board coming into contact with the passengers, and what kind of equipment exists on board?
Well, I mean, it's a quite small ship. We have a lot of medications on board because passengers very often forget their medicine at home. And there's some equipment, not much. And there is a sick bay with 2 beds and oxygen. So we have actually a lot of oxygen on the ship.
Yeah, and then do you think the doctor on board would have had specific training to deal with hantavirus or any kind of emergency plan for a scenario like this where he got sick and other patients had to step up? Is that even something that usually is on your radar?
Yeah, well, I mean, the doctors, they don't have specific training on hantavirus because there's never been an outbreak of hantavirus on a cruise ship. There are plans to how to handle infections on the ship in 3 levels. One is just to wear masks, and the 3rd level is to isolate all the passengers like we did it during COVID.
What kind of protective gear would the doctor have on that ship?
Actually, not much. Masks, glasses, face shields, but that's about it.
We have a blueprint of the ship's cabin. We know it holds 170 people, including a staff of 71 people across 80 cabins, 80 cabins, I should say. How tightly is everyone packed into on this ship, and how hard would it be to fully isolate sick passengers?
Yeah, well, there are some common rooms on the ship. There is a lounge where everybody gathers, and if you have 150, 170 passengers, that's quite packed. And then there is a dining room that can get quite packed as well. And then there is a lecture room. So that's the common areas. The rest is are the cabins.
Yeah. What is the protocol? Yeah, what would the protocol be for a medical emergency or outbreak scenario on the ship, especially if you're far from land?
Yeah, well, you can't do much if you're far from land. I mean, you do what you can do. I mean, that's and you, as a doctor, you're alone, so you don't have any nurses, you don't have any help. If a major outbreak or something happens, then you can, of course, ask if there's another doctor on the ship that can help you.
You were on board the ship during COVID. How does this moment compare?
It was worse during COVID because there were more people infected, and it was total lockdown on the ship.
We know that passengers on the cruise left to do a variety of expeditions. To your knowledge, are passengers briefed on possible health risks in some of the remote areas?
Yes, the doctor usually get them information about that.
On the trips you've done on this boat, what kind of passengers are typically on board? Are they young people? Are they young adventurers, older people?
Well, there are some, not many young adventurous people, and the rest is senior people.
Which makes it even scarier. What would your message be to those passengers and crew stuck on board this cruise ship tonight?
Good luck. I would say good luck, because it's a terrible situation to be in, because you don't know what will happen. I mean, they will probably get isolated somewhere for a couple of weeks, I would assume.
Dr. Chris, we thank you for your time.
Thank you.
We thank you for watching, and remember, stay updated on breaking news and top stories on the NBC News app, or watch live on our YouTube channel.